Hi, I'm Professor Peter Catchside from Femory Sleep Health, Flinders University.
And I'm Associate Professor Nicole Lovato from Femory Sleep Health at Flinders University.
We're here to talk about a body clock, which is our internal circadian system that regulates the timing and activity of our behaviours, physiology and biochemistry around each day and night cycle. It's a complex system. It's mainly driven by blue light exposure through the eyes to a master clock that signals to the rest of the body what time of day it is through hormone signalling to the cells throughout the body. Now, most people who've travelled across multiple time zones or had to stay awake at unusual times would have experienced jet lag, where it's difficult to stay awake when we want to and it's difficult to sleep when we want to. And that usually sorts itself out pretty quickly within a few days to up to a week or two. In some people with chronic sleep problems, particularly in shift workers, a disrupted body clock can be a major problem for them in terms of their ability to sleep and go about their normal daily lives. And one of the best ways of sorting out a body clock disruption problem is to use bright light therapy at the right time of day. For light therapy to work well requires knowing when to apply blue light versus when to avoid blue light with these sorts of blue light therapy glasses. And one way of doing it is to track hormones like melatonin in saliva or blood as a circadian marker, but that's really not practical in a daily sort of clinical practice setting. So the current standard method is to essentially guess when the body clock time is likely to be based on sleep and wake schedules, which works to a point, but it's probably not as good as we could do. Now, another method is to track the daily core temperature cycle that goes along with the circadian rhythm to pick the core temperature minimum time, which normally occurs around 4 to 5 a.m. in someone who's sleeping at night and working during the day. We've been experimenting with using those sorts of techniques to track the daily body clock using this sort of technology. So we've got ingestible capsules which you can swallow to measure direct core temperature, and other wearable sensors like the things I've got on my wrist. So monitoring heart rate is very useful. This is for core temperature, and movement is also a very useful signal for tracking the daily core temperature minimum time.
Okay, so now you're going to record your body clock using a few different techniques that we have for the next 5 days so that we can see what the timing of your body clock is doing.
Yep, so I'm going to swallow this thing. This is an electronic capsule that I'll swallow in a minute, and it records core body temperature at 30-second intervals. They're disposable, they get flushed, and they last about 24 hours, so I'll swallow more capsules over the next several days. I'm also going to wear this device. This device measures skin surface temperature. It's also got an accelerometer in it for measuring body motion, and we can also tell if someone's lying down and what body position they're in during sleep. It's a very useful marker. And I'll also wear some of these electronic eye buttons on different parts of my skin, wrist, chest, to measure skin surface temperature. And all of those signals are very useful for tracking the circadian from the non-circadian influences on core temperature. Okay, so over the next 5 days, I'm going to be recording core body temperature and other signals. The core temperature through this capsule, which is currently live. It's talking to this device and that device, so we can see temperature on the screen at the moment. It's 22 degrees. So here we go. And in a few seconds time, it should start to increase in temperature. There it goes. It's 24 degrees. It'll keep going up over the next few minutes till it stabilises at body temperature, and then it'll last for probably 24 hours before it gets flushed away, and I'll take the next capsule.